Huntington's disease presents several psychiatric symptoms, therefore affecting emotions and personality. We describe here the most common ones. It should be noted that an affected person may not necessarily present all of the symptoms described here. Furthermore, the severity and the order of appearance will vary from one person to the next. Depression. Depression affects about 40% of persons affected with Huntington's disease. Individuals with depression may exhibit the following symptoms: sadness or irritability, a loss of interest for activities and a tendency to isolate themselves, sleep difficulties and a lack of energy, less concentration, suicidal thoughts. If you believe that the affected person is thinking about suicide, you can talk about it with her. Talking about suicide does not lead to the act. Above all, talk about it with your doctor, your social worker, or your contact at the Huntington Society, because affected persons are impulsive and may take action suddenly. Furthermore, medication may be the underlying reason for the depression, so it's important to see the doctor. Obsessions and compulsions. Obsessions are impulsions or thoughts that are repeated continuously. For example, the fear of germs. Compulsions are repetitions of an action, for example, washing your hands several times per hour. These disorders may create a lot of anxiety, and it's important to discuss these issues with the doctor. Apathy. Affected individuals lose their motivation and their interest for what surrounds them. You can encourage the person to resume their activities by suggesting some, by establishing routines, and by using schedules and calendars. Irritability. The persons affected with Huntington's lose control of the expression and intensity of their emotions, which may lead to episodes during which they suddenly become explosive and angry. This reaction may be triggered by difficulties carrying out an activity or frustration with a situation, but it may also arise for no apparent reason. It is suggested to try remaining calm and to avoid situations that create conflicts and confrontations. Tasks to be accomplished can be simplified, and if possible, the person's routine should be respected. Perseveration and fixation. The affected individuals may have a fixation and talk about it constantly. For example, asking to go to a specific place or to eat a specific food. You can try redirecting attention towards something else. Another option is to establish routines, such as telling them that they can have a coffee with every meal. Anxiety. Anxiety may appear due to changes in routine or because of difficulty in accomplishing certain tasks. We can reduce the anxiety by reassuring the person, by preparing them to the idea of going out, and by simplifying choices and decisions. Hallucinations. The affected person hears voices or sees things or people who are not there. This symptom is rare. It would be wrong to say that there is no treatment for Huntington's disease. It is true that currently we cannot cure the disease. However, we can treat psychiatric symptoms with medication, which can greatly improve the quality of everyday life.